Welcome back. I'm Dr. Margaret Ames, and you're listening to Your Dental Health. You can reach me in my office in Huntington at 631-261-4525. That's 631-261-4525. Also, my website at drames.com. We're talking to Ryan Sturgis, who is a documentary maker from Mankato, Minnesota. He videoed the conference last year in Reno, Nevada, and he learned quite a bit about dentistry. Even though he's a layperson, he was like overwhelmed by the difference in dentistry and how the new paradigm is not so Civil War-ish. So, Ryan, welcome back.
Thank you.
So what did you hear at the conference that was like so surprising? Like, wow, besides the fact that they're not just white rocks in your mouth.
Sure. Well, I learned that there are ways in which dentists can treat teeth so that it keeps them intact, and that the way that dentists have been treating teeth for, I guess, over 100 years is to create space for their materials by taking away good, healthy tooth structure. And so it was amazing to me to realize how much of a problem that is, and to also realize how small of a group in the dentist profession were passionate about trying to change that. And it was great to see them all together in one place explaining to each other, but also to someone like me, very clearly how important it is that there's an upswing in dental practice.
And you're doing a big part about promoting this. You're also working on part of it being about air abrasion, which is, can you tell us what you think about air abrasion?
Well, yeah, I mean, I'll never let my kid go to any other kind of dentist. A dentist that's using a high-speed drill over air abrasion just doesn't make any sense. I've been working on a documentary sort of depicting the history of air abrasion and those dentists, those progressive dentists, using it in their practices today, and the significant benefits that come from using micro abrasion over high-speed drills, not only in just making it easier and better for their patients. You don't need to use Novocaine and don't need to necessarily drill down and do crowns and root canals when you're doing this kind of preventive dentistry, but also the advantages of it for creating bond surfaces. And of course, it's kind of funny to me to hear myself say these things as though I knew something about them before last November, but it's just so simple and obvious that these changes, these new modalities, need to be adopted because they're just so significantly better than what we have been used to here in this country for over a century.
Well, I liked a term you just used. I hadn't heard that phrase before, that the dentists in the past would remove tooth structure so that they could put their material in there. So if there wasn't enough room, and because there wasn't the gorilla glue of dentistry, they had to make it fit like a sleeve, like a cup over another cup to get it to stick. Actually, the cements in the past, they weren't cements. They were space fillers. What held it on was that the intimate fit of the crown over the tooth, but the crown was rigid.
Sure.
Crowns fail. There's big gaps underneath crowns. So now we have this. It's amazing, still amazing to me that like I'm 5 years out on this stuff, and there's like nothing's breaking down. Nobody has needed a root canal, no matter how close to the nerve that the decay was, and it's like spectacular.
And in my experience, I've interviewed dozens so far of biomimetic dentists across the country and across the world in my documentary process, and there are people out there who've been doing these, composite material, minimally invasive preventive dentistry modalities, and some of their restorations have lasted over 40 years, and so it seems like it's a brand new thing because for whatever reason the mainstream dental community hasn't embraced some of these things wholeheartedly yet. But there's a lot of evidence out there that I've found that prove how well these modalities are working.
Yeah. So I just have to interrupt. If you've just tuned in, you're listening to Your Dental Health with Dr. Margaret Ames. You can reach me in my office at 631-261-4525. That's 631-261-4525. So, Ryan, I know that you travel when you make your to make films, and if anyone wants to go to your website at True Facade, is it? Tell me again.
Sure. The URL is www.truefacadepictures.com, and you can certainly see the work that I've done with Biomimetic dentists and with the ABD there, as well as other documentary style and promotional style videos, and also short films and feature films as well.
They're fantastic. You're as passionate about that as I am about dentistry. I mean, people say to me, like, if you came back in another life, what do you think you'd be? And I always say, a dentist. I want to thank you for coming to my office. You came and you made a great little 3-minute video that tells people a little bit about what we're all about. And we're getting lots of views on that on YouTube as well as on my website. You're great, Ryan. Thank you.
Oh, well, thank you. It was an absolute pleasure. It was the proof was in the pudding when I came to your office about how important this biomimetic dentistry movement is to the patients out there. Because boy, you had so many different patients of all ages that come to your practice that couldn't say anything that wasn't absolutely charitable and appreciative of your work with them. It was the most amazing thing. I mean, think about your relationship with your dentist. If every dentist was doing the work you guys are doing, they might have patients with those types of testimonials as well.
Yeah, it's kind of like family. I want to welcome anybody who's looking for a good, happy dental home, a new dental family, to please call my office. If you're somebody who is visible, famous, and you want, for our patients who are at that level and they need anonymity, we have time where we can schedule blocks of time where nobody else is in the office when you come in. We have a few celebrities, and of course I can't tell you who they are, but we're doing amazing things for them. So you can get a sense of what the office is like by going on my website and clicking on that video link right there. So let's see, what else? What else can you tell us about your observations about all those, like Dr. Haney and Dr. Alleman, and they're fantastic, amazing people.
Well, they are, and they're all passionate, and there are questions about whether or not this is, biomimetic dentistry is going to be embraced by the public. I think, people are questioning that when they are approached with using some of these modalities in basic, normal dentist office. And all I can say is that in meeting these dentists and in meeting their patients and their clients, there's absolutely no question in my mind that anybody who cares about the health of their teeth and the health of the rest of their body would not embrace and be grateful for getting treatment such as air abrasion and preventative dentistry in the way that you can use air abrasion to take care of really small cavities very early diagnosis, early intervention. So you never even need a filling. You never even need a cap or a root canal. It never even comes into play. And I can tell anybody listening that if you haven't heard about biomimetic dentistry, look it up, because you're going to be glad you did.
There's a great website that has a lot for lay people called findabiomimeticdentist.com. But I want to tell the listeners what air abrasion is. It's really kind of fun to see people smile when you say, we don't have to give you Novocaine today, and we don't have to use the drill on you. So I have this machine that is powered under air pressure, and use a little helium to propel the little pieces of sand that are like talcum powder, and I use that instead of the drill. And it bounces off the hard parts of the tooth structure, and it goes into the areas that are soft, the decayed areas. And I tell the patients that, I'm going to sandblast your teeth. Or I tell the kids, this is like going to the beach and getting some sand in your mouth. And it's going to be really easy, and we're going to let you rinse out. So we clean it all up, and I measured. I have a little laser, the Diagnodent, which measures if I have any decay left. So I never have to drill not one enamel rod or one dentinal tubule more than is necessary to take away. Because no tooth deserves a crown. The age of adhesive rebuilding and restoration, it's here and now. The science is clear and succinct. Adhesive treatment is analytically based, and it's predictable, with catastrophic failure rates due to fracture and root canal treatment extremely low. Nobody deserves the amputational-based treatment of the past 100 years. We all learned silver fillings and crown dentistry. It's time to change. Its authors are from over a century ago. We really respect what they did. But now, instead of the big shot being G.B. Black, he contributed a lot. I'm sure you've heard his name, Ryan. But now we have my hero, like Dr. Alleman, who is just so devoted to this that we're all grateful for him and for all of our other colleagues. So we have to wind up now. You're listening to Dr. Margaret Ames with Your Dental Health. You can reach me in my office at 631-261-4525, 631-261-4525. Ryan, thank you so much for taking time out of your schedule, for sharing your talents and your beautiful work. I appreciate you, and I look forward to seeing you.
My pleasure, and I look forward to seeing Biomimetic Dentistry become.
Turns me inside out.